If you like this video, please rate, comment, share and subscribe. If you dislike it, please tell me why so I can improve. Now, it's always supposed to be a bad idea to self-medicate. You need some distance from where you are at, your own feelings about things, your own subjective impressions of things, in order to treat someone effectively. And I am, of course, violating that by doing what I'm doing now. However, I am doing it. I'm aware of risks, and I don't think there's anywhere I can go basically where this is going to be sorted, because basically what I'm trying to do is give myself loads of estrogenic herbs to make myself more feminine, and I'm doing this because I'm gender dysphoric. I know I could go to a GP, all that kind of thing, and I'm not doing that, and I recognise the risks and I'm doing something about the risks, but again I realise this is not necessarily a good idea and I wouldn't advise anyone else to do it, but it is my body and I'm doing what I choose to do with it, and this is what I'm choosing to do. So I thought I'd just run through what I was doing. First of all, the main herb I'm using is this, which is a tincture of red clover, which is 1 in 10 red clover. That is one of the most powerful phytoestrogenic herbs that's available locally. I don't use herbs that are not available in locally. Basically, I always want to use native herbs. This is a 1 in 10 tincture. That is 1 unit of the herb dried, dissolved or infused into a mixture of alcohol and water. And if you want to see that it's got estrogen in it, this may not be immediately obvious, but that froth there is the saponin that is in it, which is fairly strongly estrogenic. Now, the dose I'm taking 3 times a day is between 7.5 and 10 ml of the 1 in 10 tincture, which is more than the recommended maximum dose, because to get any effect of this kind of effect, is we're not talking about attempting to achieve balance here. We're actually attempting to achieve an imbalance and push something away from a stable state, which is an uncomfortable thing for a herbalist to do. So I'm actually taking an overdose of this, and that will bring with it various risks. Those risks include prolactinomas, which are tumours in the pituitary gland which cause the secretion of milk, and possibly elsewhere in the body as well. And another big risk, there's a number of risks, is thrombosis, because estrogen increases platelet aggregation. And in fact, I think that is a significant risk in what I'm doing from the experiences that I've had, because there has been central chest pain radiating down the arm, left arm, and up into the jaw, and also some pain in the right hip at the position of the femoral artery. So I'm not going to pretend that this is not putting my body under a lot of stress, because it is. But I have also done something about that, which is to reduce the platelet aggregation by taking very large quantities of garlic. So basically, I'm putting hummus in with every meal in fairly large quantities, and this is homemade hummus. There's a recipe for it on this channel if you want to see it, which has an unusually large amount of garlic in it, because basically I think I need to whack my body with garlic constantly in order to reduce the risk of thrombosis. And again, I wouldn't recommend that to anyone. I'm taking this once every 8 hours. I take it at 6 AM, 2 PM and 10 PM. I hold it in my mouth for 20 minutes. The reason I do that is to avoid the first pass effect. You evaporate the alcohol, by the way, by putting boiling water on it, and that evaporates the alcohol. You put it in your mouth. If you didn't evaporate the alcohol, you would have a problem with the alcohol irritating your mouth. So I don't want that, so that's what I'm doing. 20 minutes each time, under the tongue. Swill it around a bit, and that avoids the first pass effect, because in the digestive system there are 2 regions whose circulation doesn't go directly to the liver, which tends to deactivate things. One of these is the mouth, the buccal mucosa, and the other is the anus. Now obviously I'm not going to shove it up there, so I will shove it in here. After 20 minutes, I swallow it. This means that I get a higher effective dose, because it's not all deactivated by the liver, and in fact you can see the difference. Now I mentioned 7.5 and 10 mil. Now I want to explain why I'm varying that. What I'm doing is I use 7.5 when I use the other mixture, and I use 10 when I don't have the opportunity to use the other mixture that day. 10 is really quite high. It causes quite worrying side effects. I'm doing this, risking my health, risking the happiness of the people that are close to me, because basically I've really got to do this. I'm not putting up with this any longer. Okay, now the other one is Fenugreek, Trigonella foinum graecum. Now this contains diosgenine, and this is just an ordinary corner shop herb. Fenugreek is in the same family as Trifolium pratense, which is the bean family. There it is. And basically what I do with that is drink it as an infusion. Notice how dirty this cup is. The reason this cup's dirty, I just want to demonstrate, rather than washing it up, that it is basically like concrete, this stuff. You stick that in there, cover it in boiling water, leave it for a minimum of 20 minutes. In fact, I have generally left it overnight, so it's like 8 hours or more of infusion. And I've also added fennel to it, because fennel is also estrogenic, but I haven't got any fennel at the moment. This contains diosgenine, which is a steroidal saponin from which the contraceptive pill is prepared. So again, you've got a steroidal hormone in there, or hormonally active substance, and that will be taken 4 hours apart. So it's like at 10 a.m. Well, actually, it's first thing in the morning, so I get a massive whoomph of estrogen first thing in the morning, which is probably not a good idea, but I'm doing it anyway, so I can leave it overnight. Then again at 10 a.m., which is 4 hours after the 6 a.m. dose, and then again at 6 p.m., which is 4 hours after the 2 p.m. dose. I'm not sure whether the fennel's actually doing anything, so I'm sort of missing that out. So that's what I'm doing. I'm not saying it's a good idea. A lot of people would say, why the hell aren't you going to a GP about this? I don't tend to go to GPs, I'm afraid. It may be a good idea for me to do that, and I realise that I've probably got trust issues there, and also issues of going it alone, like men normally do. But that is what I'm doing. Now, whereas obviously I'm trying to achieve something quite odd here, that most people wouldn't want to do, this is actually a fairly good regime for somebody who is postmenopausal, if they are, or perimenopausal, if they're seeking treatment for any undesirable experiences that they have during that time. I probably wouldn't go with such a high dose, but there it is. So that's what I'm doing. I'm taking fenugreek, red clover, fennel, although I'm thinking about phasing the fennel out, because my initial idea was lactation. I'm no longer interested in lactation, I'm just interested in becoming more feminine. Interspersing that with the two together, and also taking massive load of garlic. I'm also losing weight at the same time, deliberately, as well as just as a result of the herbs, because I want to increase the volume of distribution, and I'm aware that there are xenoestrogens in my fat deposits, which if I lose weight I will release, and then it will have a stronger estrogenic effect. So that's what I'm doing. I know it's not a good idea, well, here we are. It's been going on since the 6th of May now, so I think it's something like 112 days, something like that. You can obviously get somewhere with it, and okay, if I'm not dead, I'll see you tomorrow. Bye.